Welcome back, James Eric Ross again, and we're discussing the three options that we have in healthcare today. We're in open enrollment right now, 2014 and 2015. The three options we had, if you recall, the temporary plan, 11 months. The ACA compliant plan that has all of the things that maybe you need or you don't need, but you're paying for it regardless. And then we have the 21st century viable alternative plan. Now let's talk about, we showed what that meant with the critical illness, with the accident, injury, and the donut hole, remember? Now let's talk about things that are just like everyday concerns that people have. And we're going to do the exact same thing. We're going to relay the prescription coverage. We're going to relay the general practitioner or just a sick visit to the doctor. We're going to relay, number 3, what that means as far as a specialist visit, if you have to go to a neurologist or something like that. And then the ancillaries, which I call, would be your labs, your imaging, alternative medicine. This is kind of a catch-all for all that, like chiropractic or things like that. All right, so with a temporary plan, again, you have that deductible. And typically what they'll do with this type of plan is they will give you a choice. So on a generic, you'll get anywhere, say, from $10 to $20 back for that generic medication that you get. And on the name brand stuff, it could be as low as $30, but it could be as high as $75 for that. And then there's a maximum for that. Let's just call that $500 maximum for the year that they're going to pay for your pharmaceuticals. With the ACA, unfortunately, we are subject again to that naked insurance. This is the second time we've seen this. And on a bronze plan, you have that $6,350 deductible. Well, if you have rheumatoid arthritis, which someone on an ACA plan, because you wouldn't qualify for an underwritten plan, rheumatoid arthritis has a medication called Enrollment. And Enrollment is seriously expensive. So you would have to come out of pocket, let's just say $1,000 per month for Enrollment, and after 6 months in a doctor's visit, you would have satisfied that $6,350 deductible. So on the 21st century alternative plan, we basically have something similar to what we shot over here, where you have for generic, it's $10, and for name brand, you have up to $30 for that name brand drug, and again a maximum of around $300, depending upon the plan. It could go up higher, $500 for the year. But the beautiful thing is, when you're working with agents like us, because we're problem solvers, we want to give you access to those cash networks and to viable solutions like mail order, for example. It's a huge thing. So don't want to spend a lot of time on this one, but I just want you to know that I know that these are questions that you have, and we've heard your concerns, and we've made them our own. General practitioner and a sick visit, okay? Both of these, again, you're not going to have what Major Medical had in the past, was that, say, anywhere from a $25 to a $75 copay. Well, the copay meant that I've already paid this and then the rest is taken care of outside of any lab or something like that. Well, today, let's use the ACA plan, for example. On a general practitioner sick visit, you would basically be, again, subject to, I hate to keep bringing this up, you're subject to that naked insurance. So unfortunately, you do still pay the copay. We're going to lump these two. For the general practitioner, for the GP, your copay would be right around 25 to 40, depending upon your plan that you have. And for the specialist visit, that would be anywhere from 40 to, say, $75. But the unfortunate part is if you have not hit the naked insurance $6,350 for the bronze, you're going to just get the repricing of the doctor's visit. So national average, and if you remember, new health choice.com. You can plug in a general practitioner if you see a urologist or whatever that is. But the national average is about $150 retail to see internal medicine doctor, your sick visit. It's about $250 for a specialist. That's a podiatrist, it's a proctologist, it's a urologist, gastroenterologist. So in this instance, you're going to get repricing, which would take this down to maybe, take $70 off of that, so you have $80 left. Well, you paid the $25 copay, you still owe them because you haven't hit that $55. So it's the same thing with this. So you maybe take $70, that takes it down to $180. You paid the $75 copay, so you still owe them $105, which is going to come off of this. Now, if we live in the 21st century, let's use 21st century technology. I love this plan because it has something where a lot of states are starting to adopt telemedicine. What telemedicine means to me is that if I have an issue and I've got 4 kids, in the past, my mom with 4 kids had to bundle the sick child up and all the other sick children and take them down to Dr. Mogul's office, where she ran the risk of having the other 3 children getting sick. So with this plan, you have the ability to call, and within 20 minutes to 1 hour, 60 minutes, you call and you say, hey, I would like to get information about my son's influenza, about my son's earache, about my daughter's fill in the blank. 83% of all of the issues that come up on the phone can be ameliorated or can be taken care of. 83%. And instead of you going to the doctor's visit, having that appointment set, and then potentially running the risk of getting sick, getting in a car accident, do it all over the phone. And then the doctor would ask, would you like that, Mrs. Jones, sent to CVS or to Rite Aid? How much would that, change your life? Think about that one. So from that standpoint, we have a general practitioner or a specialist. You can ask someone for free. And this is rolled into the plan. You don't pay anything for that. So with the 21st century plan, it's the same thing, except now we do first dollar coverage. This 21st century plan has first dollar coverage. So let's look at it again. $150 for just the general practitioner, family doctor, okay? It's $150. We take, say, again, I'm just using the same thing. 70 is the repricing. This is network. Because we belong to a network, membership has privileges. So we're going to reduce that. That's a retail. This is like almost a wholesale customer, right? We take it down to 80, and then we pay the next 75 of that, up to $75, depending upon the plan that you have. But now you can see where you're out of pocket, because that's going to get paid. It's not subject to the deductible. So your out of pocket could be anywhere, say 25 to as low as $5. For a specialist visit, we're going to do the same thing. $250 is retail, but we're not retail, are we? Because we belong to this group. It's going to take it down that $70 to $80, let's call that. So that's $170, and we pay up to $75. So your out-of-pocket for that specialist visit in this example is around $100. So I don't know anyone that went bankrupt from doctor's visits or physicals. The other thing we want to talk about are labs and imaging, because these are real world situations. If you need an x-ray and you go to the hospital, do you have any idea how much that costs? Well, I do, because I do understand New Health Choice. And as a matter of fact, I just had a CT scan done at the emergency room in Sarasota, Florida, where I reside. That CT scan, which took 3 minutes, cost $3,430. Now, if I had a CT scan on the temporary plan, I basically would be subject to the deductible, so I would pay that full amount. On the ACA plan, if I hadn't hit my deductible, I'd pay the $3,000. Well, with the 21st century plan, we want to be that advocate, that navigator, so we can come up with these cash networks. Now, what a cash network is we have these vendors that aren't getting paid by whomever. They are allowing people to pay a reduced amount. For example, an MRI. The national average, newhealthchoice.com, you put it in, is around $2,200 for an MRI. For a CT scan, you're looking at somewhere around $3,000 for a national average. For a mammogram, you're looking at a national average of, say, $600. Well, on the cash network, I can take this, we'll just name this A, B, C. I can get an MRI for as low as $200 A. a CT scan as low as $200, and a mammogram for as low as $75. What we're doing here is we're allowing you to get a great sense of understanding that our goal is that you keep and spend, keep and save that which you make. Don't throw it away by doing things like that. That's where we come in. So the last piece that I wanted to talk about was this plan for 11 months. It is limited. So it has a dollar figure attached to it for that 11-month period. Let's just call it $500,000. It could be as high as $1 million. So if you go over $1 million with this temporary plan, you're in trouble. This is unlimited. That means that if you obviously had $1 billion in surgery or whatever, they would have to pay that $1 billion once you met your deductible. With this plan, it's unique. And if you recall, we talked about something called on demand. Now, what on demand means is that I have the ability or adjustable insurance that embedded in this plan, because this plan is limited, pay for what you need right now and have something for later to take care of that. Embedded in this plan is what's called a guaranteed issue short-term rider, okay? So this rider allows you to go from a limited plan, which is say $150,000 a year, $1 million per lifetime. And if you remember Christopher Reeves, Superman, he had a horrific accident, an equestrian accident that left him with a hospital bill posthumously. That means that he was dead, but he still owed $5 million. So in that event that you have, which is, by the way, out of 1,000 people or 100 people, the odds of that happening over $100,000 in hospital bills is less than 0.1%. So that means that 99.9% of the time, your bill is not going to be over $100,000, but we want to prepare for the worst, hope for the best, of course, but prepare for the worst. That's where this comes in. This embedded into this limited plan, we have a bridge. And on that bridge, we have this vehicle that we're going to be able to take over that bridge. Not a very good looking car, but you get the idea. It's from the limited to an unlimited plan. And what that does is it's going to take us from an issue with a 0.1% probability over to, so it's a short-term plan, it's a bridge that's going to take us into an ACA compliant plan, which is unlimited. So for me, when we look at these three, and I want you to make the decision as a small business owner, as an individual, as a citizen of the United States, which of these three, because we can do all three, I can help you with all three of these, which makes sense to you? If you have issues that you need to have this and you want more information, contact us. Look at the screen, it'll have all the information that you need. But if you're healthy and you don't want to pay a lot, but you want to have that on-demand ability, then I think that we need to talk more about this, because I've shown you what the accident injury, what the critical illness, what the donut hole, that was the first one. Now we've gone into what about the daily things that you have, the general practitioner, the specialist, the labs, the imaging, and we've discovered that, but the biggest part of this is that we are anticipating the worst, but we're hoping for the best by having that adjustable premium that will take you into that unlimited plan. This is James Eric Ross, very excited about my duty, which I feel is incumbent upon me to share this information with you, reminding you to seek an expert. If you don't have the answers, ask the experts. We'll be happy to assist. Create a great day.